All right, let's wrap this all up. So first is our meconium aspiration syndrome. Now remember, the babies at risk for this are post-term gestation. They should have already been born, and so they're at risk for fetal hypoxia that can cause meconium to pass in the utero, and then they inhale it, and we have meconium aspiration syndrome. So we want to make sure that we're monitoring for yellow-green amniotic fluid, and we prepare to suction via the ET tube if they're non-vigorous. Next is our respiratory distress syndrome. So remember, this is a preemie problem. These babies are not born with enough surfactant. We expect surfactant to be sufficient between 34 and 36 weeks. So for these babies, we want to administer maternal steroids if they're at risk for preterm labor or in preterm labor less than 34 weeks. And we're going to administer inhaled surfactant to the newborn via the ET tube if they're born with respiratory distress. And last up is our TTN, the least scary of the three. And the babies most at risk for this are our C-section babies. And that's because they're at risk for excess fluid being retained on their lungs. So for these babies, it's just going to be supportive care like oxygen and monitoring their respiratory rate. So no matter the cause, your job is to always stabilize and provide respiratory support like oxygen, and then of course provide specific interventions to treat the cause.